eyebrows, palpebral fissures, nasolabial folds, and mouth at rest, and with movement and expression. These facial features may be slightly asymmetrical, but should have no edema, coarsening of features, lack of expression, or other unusual changes in appearance.
Okay, if you could look straight ahead, I'm going to observe your face.
In an older patient, the eyelids may look wrinkled and hang loosely, and soft bulges may appear under the eyes. Next, inspect the patient's skull for size, shape, and symmetry.
I'm going to be touching your hair and scalp.
Also examine the scalp, parting the hair and working systematically from the frontal area to the occipital area. You should see no lesions, scaling, or evidence of parasites. Next, palpate the skull from front to back, using gentle rotary movements. The skull should feel symmetric and smooth, with no tenderness, swelling, or depressions, and the scalp should move freely over it. Also, palpate the patient's hair. Its color, texture, and distribution should be appropriate for the patient's age, gender, and ethnic background. In men, hair loss may occur at the temples or crown of the head with age. Then palpate the temporal arteries, which should have no thickening, hardness, or tenderness.
I'm going to listen to your arteries too.
Remember, we're only going to do this if we notice one of those.
If you suspect a vascular anomaly in the brain, use the bell of your stethoscope to auscultate the temporal area. You should hear no bruits on either side. Slide your fingers down to the temporomandibular joint space in front of the tragus. As the patient opens his mouth, gently palpate the joint space. The joint should move smoothly, without limitation, tenderness, pain, crepitus, locking, or popping.
Next, I'm going to check your salivary glands.
To finish examining the patient's head, inspect and palpate the salivary glands. They should be symmetrical, but not enlarged or tender. Next, inspect the neck in 3 positions. In each position, you should see bilateral symmetry of the sternocleidomastoid muscle, trapezius muscle, anterior triangle, and posterior triangle.
Now tip your head back a little.
The trachea should be midline, and there should be no fullness at the base of the neck.
And now swallow for me.
You should see no masses, jugular vein distension, carotid artery prominence, webbing, excessive skin folds, or unusual shortness.
And now put your chin to your chest.
Now evaluate the range of motion by asking the patient to flex, extend, rotate, and laterally bend his neck.
Left.
The patient should be able to move with no pain, limitation, or joint instability.
And now lean your head to your left shoulder and to your right shoulder. And now I need...
Before palpating the neck, consider the location of its structures, including the hyoid bone, thyroid cartilage, cricoid cartilage, thyroid gland, and trachea. Then feel for the hyoid bone and the thyroid and cricoid cartilages.
And now swallow.
They should be smooth and non-tender, and should move under your fingers when the patient swallows. Also, palpate the rings of the trachea, which should be distinct and non-tender. Then check the trachea's position by placing your thumbs on each side of it. The space between it and the sternocleidomastoid muscles should be equal on both sides, indicating a midline trachea. Next, put your index finger and thumb on each side of the trachea below the thyroid isthmus. You should feel no tracheal tug or movement in time with the pulse.
So now I need you to take a few sips of water so I can examine your thyroid. So hold on to this until I need you to drink it. And now I'd like you to tip your head back a little.
Inspect the thyroid gland with the neck gently extended.
And lean your head back and swallow.
The thyroid should not be visible. An enlarged gland may only be visible from the side. Next, palpate the thyroid from the front or behind to assess its size, shape, configuration, consistency, and tenderness, and to detect any nodules. To identify the thyroid isthmus, place your thumb over the trachea about 3 centimeters below the thyroid cartilage. The thyroid isthmus should move under your thumb when the patient swallows.
Take another sip and hold it, please.
To palpate the left lobe, gently push the trachea to the left with your left thumb. Then place the first 3 fingers of your right hand in the thyroid bed, medial to the left sternocleidomastoid muscle. As the patient swallows, you should feel the gland move beneath your fingers.
And now take another sip of water and hold it. Check the other side.
To assess the right lobe, reverse your hand positions. If palpable, the thyroid gland should be small, about 4 centimeters wide, with the right lobe slightly larger than the left, and it should feel smooth, firm, pliable, non-tender, and free of nodules.
Okay, I'm going to examine your neck now.
Okay.
In an older adult, the thyroid gland may be fibrotic and may feel more nodular or irregular during palpation. As an alternative, you may palpate the thyroid gland from behind. To do this, place 2 fingers of each hand on the sides of the trachea, just beneath the cricoid cartilage.
Take another sip and hold it.
Have the patient swallow as you feel for the isthmus to move.
Swallow.
Next, displace the trachea to the left and place the first 3 fingers of your left hand medial to the left sternocleidomastoid.
And swallow.
As the patient swallows, palpate the left lobe. Then reverse your hand positions and palpate the right lobe as the patient swallows.
And swallow.
All right, any questions?